campaigns around alcohol and prevention or tobacco, and a lot of them are like massive scales where you're not going to have like a one-on-one connection with somebody. All of our communities have my phone number, my email address, Christina's email address, Christina's phone number, which maybe we should have rethought that sometimes. I'm just kidding. But, no, but they have a one-on-one connection with people who have been there, who have done the similar work, in the community. We have seen the same type of, obstacles that they come up with. So you really have two people who, have been there, training you and helping you figure it out for your community. I think a lot of people, when they first come on, especially if they're not already coalitions, if we have some of these health departments or police departments coming on wanting to do CLD in their community, they're kind of like, okay, what do we do? And so we can kind of come in with two people who have done the work and give them some ideas of where to start, and just some avenues to kind of try out and see if it works for their community. And some people it doesn't work and they try something else out, because there's a lot of different ways it could work in your community. I mean, I think that was my favorite part about you utilizing CLD here in Williamson County, was just you could really make it your own to see how it worked. And all the messaging's still the same, but just the way you use it could be different. So,
yeah. We're in several other states now too, and so what we kind of pride ourselves in, as I mentioned earlier, is we want to do something, with you, not to you, is that we're open to changing certain things. Yeah, as Alex mentioned, the message is the same, and we want you to use some of the tools, and there's certain framework, but when it comes to how you implement and the order you do it, sometimes you need to get the campaign out there first. Sometimes you need, like Nashville, to work on the policy first. And so we're really there to help you make it work for you, because our main goal at the end of the day is to see a reduction in substance use disorders, to see reduction in access. And so if we can help you get there, we're not going to mandate any special way to do it. We're here to get the best for your community. And, Rhode Island is very different than Tennessee. So we had to deal with a lot of, even the way they're set up is regionally, we dealt with a lot of different things than we did when in Tennessee and some of our rural counties. So we're really open to just working with people and working the process and just building that infrastructure and helping you build it to bring the right people to the table to implement CLD, but also many other things that are going to help make your community better.
Yeah. I don't think we've ever said no to anybody completely. We're like, okay, how can we make this work where, it's still keeping on the CLD message, our mission is still there, but it's still making it work for your community. I think we've always worked with people, however, they see that it fits for them.
Yeah. What's an example of like a difference in Rhode Island, for example, compared to Tennessee?
So they were very dedicated in getting it in the urban areas first. And so they wanted to work with their sports teams, so their hockey teams and things like that, to get the messaging out, and also with their public transportation, with one-on-one with bus stops and getting things. So instead of directly working with pharmacies and providers, which is traditionally where we come from, they really wanted to work where they saw people would read messaging and start getting it. So their brochures and ideas about policy change actually came from public transportation and what the people that were getting on the buses and how they could meet people where they were, so to speak, and working with their major sports teams. And so it was a different way of going about it. And now they're working towards more with providers and seeing it. But they've done it across their state. They've been very successful with the messaging and how their coalitions are working on it. It was just a different approach than we took in Tennessee.
Yeah. And so I know you mentioned a little bit about kind of the education that you do with people in the healthcare profession. Like you even mentioned that doctor who's like, oh, I just prescribe it. I don't really have anything to do with this problem. So what are some of the challenges when you're dealing with, doctors, people in the healthcare field, and trying to maybe educate them or train them in some way of how they can make a difference?
I think for me, the number one thing is, and this is why it's so important with coalitions to have the right people at the table. For pharmacists, talk to pharmacists really well. Doctors, talk to pharmacists. I'm a coalition leader, so I don't have a medical degree. They're not going to listen to me the way they're going to listen to one of their peers. And so for us, it's that connection of having doctors that are on our team who believe in what we're doing, pharmacists that are willing to tell the message. So for us, it's the right vehicle, to get it across and to kind of tell them that, yes, you should listen to these people. They're not crazy, that they're going to tell you something that you could do that could change. And I would say one of the other major barriers is people just not seeing that that they could be part of the solution, even if they're not prescribing. Dentists are one of the first place that kids ever get a prescription for an opioid for getting their teeth out. Took us a long time to get dentists on board because they were like, we don't do it that often. And they don't, but statistics show that they have very few amount that they prescribe, but they're the first place that people are getting prescribed. So it's important for them to be part of that. Same thing with veterinarians. We have a lot of depressed cats, a lot of hurt dogs out there, and they're the same medications. A lot of people don't know, if you're not animal persons, a lot of the same medications you can get at your Walgreens for anxiety, or they're on hydrocodone just like we are. And so all of them need to be part of that discussion and part of the solution. And so really just getting them to realize that it's important and they can be part of it, and it's not going to take too much time. And so for us, it's about, we can get your office manager involved. We can get one of your CNAs involved. We can find a way to make it work for you where you don't feel like you're taking on too much more. Because what we always say is we've all sat in a doctor's office too long. So how can we make this in a way that's quick and simple? And that's why when we were developing the materials, we brought pharmacists and doctors and dentists to the table to make them with us, so that it was them talking to their peers and helping us facilitate it so it worked for them, because we don't want to make a burden for anyone. We want to make it easy.
Yeah, I was going to say, I think a lot of this comes back to just education around stigma reduction. There's just an idea that I'm not involed in that, or I don't have to deal with that.
Even like the dentist, they probably we don't even want our name associated with this crisis.
Exactly. So it's just educating people that through that, and that, everybody can be a part of the solution. We all have to work together on it. I think that's kind of the biggest piece, is just that. And that's not necessarily just with, doctors or pharmacists. That's just kind of with everybody. Like you mentioned, people kind of walk around our table when we're at a health fair. I mean, this is kind of, they're just like, nope, that's not me. I don't have any kids in the home. Can you tell me how many people? I don't have any grandkids. I don't have any kids. And I'm like, that's not really just, okay. It's like, so yeah, I think that's the biggest piece, is just stigma reduction.
Yeah. Yeah. And so for medical professionals, people in the treatment industry who might be listening, what are some ways that you would encourage them to, either partner with you guys or another organization in their area that's similar, or, other ways they can take action to kind of promote this mission?
So, like, as Alex mentioned, we have a point person in every county, so we'd love to hook them up with the person locally that they could work with, but they can always work directly with us too, and we can help facilitate any conversation. But just reach out, and we can really help you figure out an easy way to have these discussions. We first want people to just be talking to their patients and provider and consumers in general about drug safety, about how something they might be prescribing could end up as a substance use disorder, and just having really honest conversations about pain and mental health. And so we have all the resources to help you do that, and to set up a policy or some type of program within your practice. And we'd love to help in any way we can to do that. I don't know if there's anything you want to...
I think that's good.
Yeah. And so then kind of for just in general, like we were saying, like, don't flush the pills. What are some other misconceptions that are still clinging to the American psyche?
That is a big one.
Yeah.
Don't flush your pills.
Don't flush your pills. And also, don't feel like people could just get over this. Like, it is something that...
Over the addiction.
Over substance use. And as we talked about before, this is a human problem, and we're all human, so we're all affected by it. So each person, just having conversation with someone, just talking to your own doctor and being like, hey, I think it would be great if you would talk more about mental health and substance use disorder when I come in. Everyone can be an advocate for this. Really what we're talking about, I think that's why we work so well with health departments, is a lot of this is health literacy. Like, be your own advocate, encourage your providers, encourage people in your community to have these discussions. Ask really how someone is, and realize and have a discussion with people if you know in your community that they have a kid struggling with a substance use disorder or themselves, and have the conversation about it. And I know it can be awkward, but the more we talk about it and we normalize it in the way that it's happening to everyone, the more people realize they can be part of the solution, and we can all be there to support each other, that it doesn't have to be a lonely road. Because these families a lot of times feel like they're in this by themselves, and the more connected we know in coalition, it's a true statistic, the more connected we are as a community, the less substance use there is, the less mental health issues we have. We need to be connecting to each other. That's the number one thing we need to be doing. And so just reaching out, everyone, as Alex mentioned, is part of the solution. And so just reaching out and finding a way you can be part of that solution, I think, is the best thing. Don't feel like there's nothing you can do, because a small act of kindness can go a long way with this.
Every